And opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare, and we are a certified home healthcare agency. We are servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And today I'm excited to introduce everybody to Dr. Sandhya Pattem. And she is right here in Jupiter. The address is 175 Tony Penna Drive, Suite 101, Jupiter, Florida 33458. Her phone number is 561-746-2033. Website is jupitergardensprimarycare.com. And the email, info@jgpcp.com. Thank you so much for joining us, Dr. Pattem. We appreciate you taking time out of your busy schedule. I know you're very busy with your practice and you have a family, so thank you so much for doing that.
My pleasure. Thank you so much for having me here and the opportunity.
Absolutely. So, Dr. Pattem, let's share a little bit more about your background real quick. Where did you go to school? When did you, decide you wanted to be this type of primary care physician?
So I did my medical schooling from India. And
Nice.
from a town called Hyderabad,
Nice.
in the southern part of India. And then I came to the United States after my medical school graduation to the University of Alabama at Birmingham to do Masters of Science in Public Health. And then moved on. I completed my USMLEs, the exams that you have to write, the rigorous training that you really have to go through. And then moved to Michigan. I did my residency from Genesys Regional Medical Center in which is a Michigan State affiliated program.
Okay.
And finished my training in family medicine.
Oh, okay.
And then moved down to South Carolina to practice the real world. And been there for a long time. Then I had a small move to New York while my husband was doing his residency.
Okay,
and
he's
then
also
moved,
a doctor.
Yes.
Okay.
And then moved back again to South Carolina and been there for a decade. And 3 years ago, I moved here to Florida. I have a child with special needs, and I came here in pursuit of a special school, which is very known to have high quality education for special kids. So that's my story in a nutshell.
We're lucky to have you here.
Thank you.
Thank you so much. So let's get into a little bit about the Jupiter Gardens primary care and anti-aging. So what type of patients are you seeing? Do you have a specific demographic, or what does that look like?
So it's anybody for the most part more than 18.
Okay.
I'm family medicine trained, so I do cater to some kids, but I only do if parents bring them saying that, hey, I have an urgent need and my child needs to be seen, but I try to limit more than 12.
Okay.
I haven't really started doing any vaccinations. That probably is one of the biggest reasons as to why I'm not really catering to kids at this time.
Oh,
so
I see.
Mostly 18 and above.
Okay. Okay. So what about insurances? What type of insurances? Are you accepting major insurances?
We're accepting most major insurances.
Nice.
Yes.
Good.
Medicare. We don't have any Medicaid.
Okay.
I've understood that credentialing is very difficult in Florida. It's taking a long time. So, but we have been able to get on to most major insurances like Blue Cross Blue Shield, Aetna, Cigna. What are the other ones? Oscar. I think Oscar is also a big one in the area.
Humana, Oscar. Yep. Nice.
Yes.
So, as far as family care medicine, I think I was reading that you are also focused with geriatric patients. Is that right?
So I've done a lot of geriatrics
Tell us
in my
about that.
career. I was freelancing a lot with nursing facilities, and I did a lot of hospice to work
Okay.
around basically the schedule of my child.
Okay.
So it kind of like gave me a lot of exposure to geriatric care. So I can say that for the last 8 years, I've mostly focused on geriatric care.
Wow.
So, and now I'm getting back into above 18 care. So, but I worked with Humana, and they did take some people under 65. So it's not that we cannot do that, but mostly for the last
Sure.
8 years, I've been doing a lot of geriatrics.
So, how does that shift your perspective as far as working with seniors and geriatric? And did you say hospice as well?
Yes.
So, how did that shift your perspective? Because it seemed like that's a whole different ball game as far as patients and whatnot.
I think geriatric care is more challenging. Just with you accumulate all the morbidities and the complex medical conditions, at that
Sure.
phase of your life. And it's exciting actually to take care of them. And hospice actually has given a much empathetic perspective. So I think your outlook towards practicing medicine changes a lot. The family dynamics, you see a lot of them. It's so hard for any of us to let go of your loved ones,
Sure.
and so handling the dynamic is very subtle, and to kind of like talk about end-of-life care and saying that they're hospice eligible and what does that exactly mean in the real perspective.
Yeah.
So all of that is a different dynamic that has to be handled very carefully.
Yeah.
And but I've enjoyed hospice. I think I can say the most of everything that I've done so far.
I always
So-
love when I meet a doctor who has just experience in different arenas within the healthcare industry, because I feel that makes you a more rounded, more, just
Yes.
more open and more rounded as far as viewing and having a perspective towards the patient.
Yep.
Yeah.
And I've actually done a lot of urgent care in between to
Oh, you
kind of
did?
keep up with the less than 65-year-olds, because I was mostly focusing on
Sure.
geriatric care. So I
Yeah.
did actually do a lot of moonlighting in urgent care centers.
Oh, okay.
So
Okay, nice. So that definitely makes you well-rounded. If you saw urgent care patients, I'm sure you were seeing a lot of
urgent issues,
Yeah.
younger populations, chronic disease management. When they run out of medications, they want to come to the urgent care.
oh wow.
So lacerations, procedures. So it's pretty interesting.
It sounds like that's a problem. If they run out of medication, they just think, okay, I'm going to run to urgent care and take care of it.
Right. I think it's always better to see your primary care team,
Uh-huh.
just because they know you very well, and urgent care is the point of care.
Right.
So obviously, not everything, your medical health and entire perspective does not really go into it.
Exactly.
But sometimes we don't have a choice. I think we all have been seen at urgent
Oh,
care
yeah.
center at some point.
Absolutely.
So, yes.
So if I, recommending you to our audience, what can we expect from what we would experience at your facility? What would that look like?
So we are a one-member practice. I'm the only physician
Okay.
currently, and we have very compassionate team members that have been there for 15 years in the same practice.
Oh, nice.
So I've acquired it from a physician that has retired recently,
Okay, nice.
and he's retired to Portugal.
Okay, lucky.
So he was in search of somebody that he could entrust his 30-year-old patient population from. Like
Right.
patients that he had for the
Sure.
last 30 years. I don't mean
Sure.
age-wise.
Yes, yes.
And he said that he didn't really want to give it to the corporate sector, and that's basically why he was in search, and he kind of hung on until he could find a better fit that he could actually put his trust in.
Wow.
So so we have a lot of patients that have been there in the practice for many years. So we have a very good intake process. I do spend at least about 30 minutes when it's a new patient,
I
for
love
sure.
that.
Because I think the first visit is very important to understand and to get all the history in, and to see as to where they stand at that point in time with their health conditions. Take their medical history, and we do have access to quite a few outreach medical sites like Jupiter Medical Center records, Quest. I can access the records, with the patient's consent, of course. And so we get a pretty decent perspective. I can access their immunization record from the Florida State Department. And I can get all the medications that they filled in the last 1 year. So we kind of get a very good, decent idea about where they stand with their health at the first time that they come in.
I think it speaks volumes that the doctor waited to find the right person to entrust his patients with, and he found that in you. So I feel that this is the type of doctor who really was in tune with his patients, and what you're saying, he didn't want to just let it go to corporate. And so to pass on his business to you, I feel like it really speaks volumes for what he saw in you. And so I know that if he saw that, I know that your patients are in good hands for sure.
Thank you.
Definitely.
I've been blessed, really been blessed with, they've been very supportive all along the way with the transition process.
Nice.
Even in Portugal, even from there, they're supporting.
Nice.
And they keep sending me, so they're still in touch with the patients via
good.
WhatsApp and emails, and they keep sending me their testimonials and what they think of me and all that. So it's been a very enriching experience.
I love that. And he's still involved, which shows me that he was the type of doctor that was so compassionate. He wanted to make sure he found someone. So that really is, that's amazing. I feel like it was definitely a good fit. You're definitely meant to be there.
Thank you.
Yeah, for sure. So let's talk a little bit about, because I know you offer other options and other things at the facility. I think you also do Botox, fillers, is that right? And different type of aesthetics?
Yes.
Nice. So you incorporated that into the primary care.
Yes.
Which is good.
We have mostly primary care, and we have a small segment, have a med spa room set aside.
Nice.
And I think most of my med spa patients are my existing patient base.
Nice.
So I did have some patients in my previous practice also, and they've kind of like are coming back down again for the aesthetic services and primary care services. So it's going smoothly, yes.
It makes sense, because if I'm going to my primary care and I know you're offering those services, I already trust you, well, it just makes sense that I would do that with you at your location. So that's a really good add-on to have, and people are looking for that.
Yes, and trust is very important, I think, with aesthetics. So
definitely it is.
Yeah, you don't want to let anybody work on your face. So
I hear you, exactly. Yes. So I hear that tomorrow is International Women's Day, is that correct?
Yes, happy International Women's Day to all the clients,
nice.
to all the women out there. Yes.
So Dr. Pattem, what do you suggest to women who are listening right now? You know, maybe they're not happy with how their health is going in that direction, or they feel that they want to, you know, see the right doctor, or you know, we're aging, we're 50-something, and things don't look the same, and we're not feeling the same. What would you suggest to women that are listening to this?
What I would say, I think, I encounter this a lot of times in my practice. Women come to me in their 50s and 60s, and they say that they've only been seeing gynecologists, and they were getting their mammograms done, and that basically is what they think is primary care or preventive health.
Right.
I think there is a lot more, apart from just like limiting your preventive health checkups to pap smears, gynecological checkups, and mammograms. So your other health is kind of completely omitted out, ignored.
Yeah.
So you need the regular preventive health checkups. You need to know as to what your heritable disease risk is. You know, you inherit hypertension, cardiovascular disease conditions, heart disease, cancers. And I think all of these also need to be screened a little earlier and not really wait until the 50s and 60s.
Sure.
So I probably would suggest that they, all women, please start seeing a regular primary care physician too. So in my practice, I've seen that gynecologists have been catering, and I think it's a lot of burden on them, because they also have to keep up with all the recommendations and the guidelines that's evolving very dynamically over time. And they've been doing some blood work, but I don't feel it's completely comprehensive that one needs when you're only seeing gynecology, which is also important. You need to keep up with your gynecological checkups and your mammograms, but at the same time, I think the other component cannot be ignored.
Right. So what kind of blood workup? You do cholesterol panel, you do what else? Blood sugar?
So I would think when you say a comprehensive lab or a blood panel, I would say a chemistry which kind of checks for the electrolytes in the body, your kidney function tests, your liver function tests, your CBC to check your hemoglobin status, vitamin deficiencies, your cholesterol panel, your hemoglobin A1C to assess your if you're a diabetic or if you are anywhere close by, if you're a pre-diabetic.
Right.
And if you're obese, the combination of hemoglobin A1C, insulin levels, and your lipids can talk a lot about your metabolic issues in the body, and thyroid. So we encompass all these. I check for vitamin D levels, B12 levels, folate. I put all of these in my comprehensive blood work panel.
We'll continue this conversation right after this commercial break. We'll be right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back into our show, sponsored by All County Healthcare. And we have Dr. Pattem, and I'll give you her address. She's right here at 175 Tony Penna Drive, Suite 101, Jupiter, Florida, 33458. Phone number is 561-746-2033. And the website, jupitergardensprimarycare.com, and that is info@jgpcp.com. So, Dr. Pattem, we were talking about blood tests and what you'd cover. Can we talk about some primary preventative care and talk to us a little bit more about prevention?
So primary prevention basically is trying to catch diseases before you even have them. And to do that, annual wellness physicals, preventive checkups, the screening guidelines, all of those are important to catch everything to prevent something from coming on. And these could be indicated by your heritable risk, your family history of heart disease, your family history of cancers. All of these can talk towards what you probably could be predisposed to, depending on your genetic makeup and depending on your lifestyle and all that. So secondary prevention is basically once you're diagnosed, trying to managing that and keeping it under check and control to have better outcomes in future is secondary prevention. So we do have something called USPSTF.
What is that?
It's United States Preventive Services Task Force. So they've laid some guidelines as to what age groups and what kind of screening guidelines do you have.
Interesting.
So let's say, for example, if you have somebody who comes in, a woman who comes in at 55 years of age, so they need a annual wellness check, a complete physical, a comprehensive lab, a pap smear every 3 to 5 years, depending on the sexual risk. A colonoscopy after 50, and now the screening guidelines have changed to 45.
Oh, wow. Is
Right.
it because the risk has gotten higher for
I think
that?
we are changing with regards to our exposure, our
Okay.
lifestyle,
Yes.
fast foods,
Sure.
foods that are adulterated, a lot of toxins around and all of that. So I think a lot of patients are getting diagnosed very early and they're actually at risk. And that's basically why the recommendations are changed. But again, you have to take all the risk factors into picture before you kind of
Sure.
like screen them.
Sure.
So, and they've also moved to 40 for people who actually have a family history of colon cancer.
Now, do you do genetic blood testing to see what, like, you mentioned something about hereditary. Is it, are they able to test with blood exams, maybe hereditary?
Yes, there are. There
Okay.
are, but there are some specialized companies. There is cancer genetics with Jupiter Medical Center that we usually refer our patients to.
Okay.
And they can do all that.
They do
Otherwise,
that.
we have some resources that I usually guide my patients to, some pointers called Myriad Genetics and even 23andMe. They
Oh,
also,
wow.
if you kind of do the disease side of it, you can actually screen for some conditions.
I didn't realize they do that. Oh, wow. So they're able to screen for certain conditions.
Yeah,
Okay.
it may not be comprehensive, but
At least it gives you
Right.
an idea, right?
yes, most of the time they have some nurse navigators who can actually take you and they can guide you as to what test would be good for you. So, right.
Nice. So, what do you do when someone is, let's say, they tested positive, they're now needing more care, and they're like, oh, I haven't been to a doctor in 10 years or whatever. What route, how do you guide them into this new, like, do you talk to them about lifestyle? Do you talk to them about their new healing journey and what that's going to look like?
Yes, so I think lifestyle changes goes a long way.
Absolutely.
So, right, I think we are seeing a lot of rise in obesity. Very simple lifestyle changes go a very long way, like, cutting back carbs, trying to maintain a good, healthy BMI, regular exercise. Recommendations are basically at least like 30 minutes, at least like 3 to 4 times a week, with some 10 to 15 minute sessions of high intensity exercise. They all go a long way. Incorporating a lot of fruits and vegetables into your diet, cooking at home,
Yes,
eating at
that's a
home and
big
not
one.
eating outside.
Cooking at home.
Trying to prevent processed foods, eating organic. So all of these basically are very important to incorporate. Limit your BMI to 50 to less than 25, which is a normal healthy BMI. So
Yeah, I mean, everything that you're talking about, a lot of these illnesses are rooted in lifestyle.
yes,
So-
and keeping up with your regular checks, at least annual physicals, your labs, your cholesterol, everything, and then seeing your doctor every 3 months if needed, especially if you have some
Right.
diagnosis that you've been diagnosed of.
Right.
And,
Yeah. So I think we were going to touch again before we end a little bit more about the aesthetics portion and what your patients can look forward to when they go there for that.
So I do offer Botox and dermal fillers, platelet-rich plasma, PRP.
Tell us about that, because I know a lot of people that's like the buzzword now, PRP.
Yes,
So
yes,
tell us a
PRP
little
and
bit about-
PRF. So PRP has many uses. So we draw your blood, we spin
Yeah.
it in a special machine, and then you get this liquid gold that you can inject anywhere, which is miracle.
Nice.
So it can go into your face, into your hair, into the joints, into
Wow.
into any of the problem areas, which requires healing, which is crying for help kind of a situation. So it's been actually gaining a lot of momentum and a lot of recognition with helping with healing.
So is it the stem cells are extracted, or with the nutrients of the blood, or?
So basically, when you spin it down,
Yeah.
you have the white of the blood, and all the red cells and the white cells settle down
Okay.
into the heavy portion, and then you have the white of the blood, which actually has the miracle nutrients.
Oh,
It
okay.
has the growth factors. It has platelets. So platelets are the healing powerhouses in your blood.
Nice.
So wherever you have a small cut, platelets accumulate and aggregate, and that's basically what they lay down the mesh of matrix of fibrin and all that, and they help healing. So that's basically what we are extracting when we do the PRP and inject into the face and hair for hair growth and hair rejuvenation
Wow. Hair growth and hair rejuvenation.
and face rejuvenation, joint rejuvenation.
See, that I like, because to me, I'm like, that's natural. I mean,
very
that's from
natural.
myself. It's not, so that to me is very enticing, and it sounds Like it's something that I can't go wrong with it. It's my own, from
It's
my
your
own
blood.
body.
Yes, it's very safe.
Yeah.
You can't really go wrong. Even if you inject into the artery or a vein, I think
Right.
you can go wrong where it's your own blood.
Exactly.
So yes, it's very safe.
I think that's great that you're offering these natural alternatives as well, because a lot of people are looking for that. Yeah.
Yes, yes.
They're definitely looking for
And the
that.
results are really good. So I've actually found the best results with PRP compared to, I feel Botox and PRP probably are my most favorite options if I have to choose from all the wide
Sure.
array of services that we have. I'd like both of those a lot.
You said PRP and then you said something PRF. What is the difference?
So when PRP, when you actually activate, when you heat it up a little bit, or if you, with special mechanisms and adding a little bit of calcium gluconate, you
Okay.
can make it into a very small gel, which will act like a natural filler.
Oh, interesting.
And can be used as dermal fillers.
Oh.
Your own natural
I'm
filler.
gonna have to drive to Jupiter and see Dr. Pattem.
Yes.
So we have actually a minute left. This interview has gone by really quickly. I usually like to end the interview if you could just give our audience any takeaways and what your advice would be.
So take-home points, lifestyle changes is a huge one.
Yes.
Exercise, adequate hydration, sunscreen,
Right.
daily skin regimen, especially for women because it's Women's International Day tomorrow.
Oh, right.
So
Thank you.
hyaluronic acid, niacinamide, vitamin C, sunblock. All of these are major, and microdermabrasion 2 times a week, just to kind of
Oh,
like take off
nice.
the dead cells.
Take off the dead
and
cells.
rejuvenate. These are all in-home stuff that you can
Sure.
do. And in-home tips, exercise, yoga, Pilates, swimming, all of these are very good exercise regimens, even for people who actually have arthritis and joint conditions.
Right.
And trying to limit over-the-counter medications, sometimes there are risks associated.
Exactly.
I see a lot of patients who actually are overdosing on Motrin,
Oh
and
my
they end up with
goodness.
like, I mean, not overdosing, but
Sure,
like
but
chronic,
then-
regular, long-term use for chronic, migraines, headaches,
Right.
joint pains and stuff like that.
That builds up in the body.
That builds up, and then that can cause water retention, increase in cardiovascular disease conditions, and also
Wow.
kidney conditions, kidney disease.
Well,
So-
thank you for your time. The show is complete. We want to thank you for taking time out of your busy schedule and sharing all your knowledge with us. And we will see you next week. Thank you, everybody, for tuning in to You and Your Doctor. Have a great day. Take care.